right. Well, welcome again, everyone. Thank you for joining us, and thank you for everyone watching at home. Today we have Natalie Terrell and Ariel Moraney, who are Masters of Social Work interns with the Department on Aging, and they're going to talk about levels of care and transitioning between levels of care. So thank you, Natalie and Ariel, for presenting for us, and I will let you all take it away.
Yeah, thank you so much. Let me just get the screen share going. Okay. Awesome. All right, so like Kendall said, we're going to be talking about levels of care, transitions in care. So we're going to talk about all the different levels on the continuum of care, warning signs to look for that show that it might be time to move your care recipient up the continuum of care, how to determine which level of care is best for them, and then at the end we'll kind of go into ways to kind of introduce these changes to your care recipient. Kind of communication techniques. Yeah, so we hope that you find the presentation useful, and like Kendall said, we can do some questions at the end. Just put your questions in the chat, and we will try to get to those.
Okay, so hi everyone. As they mentioned, my name is Ariel and I'm an MSW student as well as Natalie, and I'm studying at North Carolina Central University. So to get us started, I'm just going to go over some of the major types of care that a lot of us may have heard of or are already familiar with. And just based off of everything that's going on, some restrictions and requirements for these different types of care may be different due to COVID. So assessing those things when looking at specific agencies of interest are a good thing to think about. So to get us started, we'll begin with in-home and or respite care. This is when aides will come into the home and they'll assist with your daily or essential tasks like bathing, eating, changing, or staying active and exercising. They can help with short-term relief or assistance to caregivers throughout the week for a couple hours at a time. Normally, some agencies do offer 24-hour in-home care, but cost and requirements may vary for those specific services. There, you have your home aides that are your most common type of aides, and for more medical assistance or other types of assistance that'll be needed, it may be a good thing to consider looking at certified nursing assistants that can administer certain medications or they're able to monitor vitals. So more of the medical side is what your CNA will do versus just your in-home aide. So up next, we have adult daycare facilities. And these adult daycare facilities and agencies will offer care during the day if caregivers need to run errands, if they have to work, or if they have personal duties that they need to attend to. They typically offer these adult day services in full-time or half-day options, and they will typically provide meals, social and therapeutic activities throughout the day, and they can also administer health services that you as a caregiver would to your care recipient. We'll next look at assistive living communities, and these are communities for residents who are primarily independent and can do a little bit more for themselves and don't need as much overview or care. And these residencies have trained staff that work around the clock as well that can help with your daily essential things such as medication, meals, and housekeeping. And these communities often also offer your essential amenities like laundry services, transportation, and exercise programs. But these are definitely something that can vary just between the specific living communities, like if it's an apartment or if it's a townhome type community. We next have our nursing homes and facilities. And these facilities will provide 24-hour care or more consistent monitoring if that's necessary. Nursing homes are a good thing to look at. They are equipped with potentially necessary medical equipment, as well as trained staff that will be there 24 hours to utilize that equipment. You have your skilled nursing facilities or homes that can provide long-term care to seniors who are living with chronic or more serious health conditions. The last two that we're going to look at are palliative and hospice care. And palliative care will offer or provide social, emotional, mental, and practical support to anyone with a chronic illness. Palliative care has a goal to maintain that curative treatment unless the care team believes that the treatment is no longer working. If the treatment is no longer working, this will be a time that may require transitioning into hospice or what they call comfort care. And palliative care can take place in the home as well as at your nursing home facilities, and it's offered to anyone at any point of their diagnosis. And our last level of care that we'll look at today will be hospice care, which is the type of care that transitions into the end of life stages, so 6 months or less. And hospice care works to manage these symptoms while you provide comfortability after this treatment has stopped. And kind of what we were just talking about, it's no longer working. So we're transitioning into other phases. Hospice teams will work together with you, your care recipient, caregivers, and family. They offer typically 24-hour a day, 7-day a week assistance, just because things are subject to decline during the hospice phase. So overall, these are our most common types of care to look at during the different levels of transitions in care.
Awesome, thank you. So now that y'all know a little bit about the different levels of care available, I'm going to talk about kind of warning signs to look for that tell you it might be time to transition your care recipient to a higher level of care. So if your care recipient lives at home alone or with minimal support, the most important thing to think about would be safety. So here are just some various things to think about. Ask yourself, would they be able to effectively respond to an emergency? For example, if there was a fire, would they be able to call 911, get out of the house, or use a fire extinguisher? Are you worried they might leave the stove or appliances on? Do they smoke? And if they smoke, do you think they might leave burning cigarettes unattended? Do you worry about them being around household toxins like cleaning products? So think about, is there a chance they might misuse them, possibly confusing the bottles? Do they know when it is and isn't safe to open the front door when someone knocks? Another thing to think about here is finances. So have you noticed if your care recipient is spending an unusually large amount of money on their credit card, they may be making hazardous spending decisions or, possibly financial exploitation. And along that vein, do you feel comfortable with them accessing the computer on their own? So do you think they'll make safe decisions? Something else to consider is, do they wander? People with dementia specifically sometimes wander, meaning they get lost even in familiar places. Does the person leave the house in the middle of the night? People with dementia, again, sometimes mix up days and nights and may get up and go during the night. They might think it's time for church or, to go to the store. Is your care recipient losing their ability to drive safely? Do you feel comfortable with them in the car? Have they been falling? Are they able to get help when they fall, such as by using a cell phone or a life alert system? Falls are a huge safety concern to look out for. And kind of on that note, do they keep their space organized or cluttered? Cluttered spaces, of course, increase the risk of falling. Yeah, so these are just some potential safety concerns to think about. If you think that the safety risk of your care recipient being at home alone or with little support is too great, you might want to consider moving them up to a higher level of care. Another aspect to consider is personal care needs. So is your care recipient able to care for themselves properly? Here are some things to consider. The first one kind of goes along with safety. Are they taking their medications properly? Do you worry that they might be missing doses or taking the wrong amount of medication? Are they able to dress themselves? Are they able to use the restroom and bathe independently? How's their mobility? Are they able to get around the house, get in and out of bed or in and out of chairs? Can they cook for themselves? And On that note, do they eat a healthy or balanced diet? Are they able to perform housekeeping tasks on their own or take care of their finances? And are they able to handle, repairs and things of that nature around the home? So if your care recipient is having trouble with these things, it might be time to move up to a higher level of care so that they can get the support they need. Our next warning sign to look for is caregiver burnout. So your well-being as caregiver also plays a part in determining if it's time for a transition in care. Caregiving is a demanding job that can have a harmful impact on someone's physical or mental health. So the accumulated stress from caregiving can lead to something called caregiver burnout, which is a state of physical, emotional, and mental exhaustion. When we aren't doing well ourselves, how are we supposed to care for other people properly? Sometimes getting outside help or moving your care recipient into a care facility is the best thing that you can do for them. It doesn't mean that you love or care about them any less. You'll actually be a more effective caregiver. If you're feeling less stressed and overwhelmed, you'll be able to be more present when you are with your care recipient and get quality time with them. So here are some signs to look for that indicate that you may be experiencing that caregiver burnout that we talked about. So the first one here is poor self-care, meaning that you neglect your own needs because you're so focused on your care recipient needs. This could be things like poor eating habits, lack of exercise, lack of taking time for yourself, relaxation time, not resting when you're sick or getting sick frequently because your body is so run down. It could be skipping medical appointments or not getting the medical care that you need. Some other caregiver burnout signs, so anxiety, you can't stop worrying even when you take a break, your thoughts race, you have trouble sleeping, can't get your mind to calm down. You might have constant exhaustion even when you get enough sleep or do take a break. You might have difficulty concentrating, meaning your mind is just going 100 miles a minute and you can't focus and get your work done. You might have some irritability or anger, including possibly towards your care recipient. Might have increased substance use like drinking or smoking kind of to help you cope with the stress. Something might be low satisfaction. So caregiving, for example, might not give you satisfaction like it used to. You might just feel like you're kind of going through the motions. And other things in life might not give you as much satisfaction as well. So you might have persistent feelings of sadness or hopelessness, or the last one here is poor physical health, because our mental and physical health are very strongly connected. So if your mental health is suffering, your physical health might suffer in response. Yeah, so if you've noticed some of these things, it might be time to consider a transition of care for your care recipient, just so you can make sure that you're taking care of yourself as well. And I wanted to add here that the Department on Aging has several caregiver support services to kind of help you through the stresses that often come with caregiving. So we have virtual support groups and activities, caregiver education, like this presentation here, as well as counseling services. That's something kind of new that we're offering. So if you're interested in any of these, please reach out to us and we'll see what we can do to help you.
All right, so when looking at choosing the best care options, there's a few things that can be considered, and that is addressing the primary needs and
We use the TV control.
Okay, so looking at the current health conditions that exist, as well as how severe those health conditions are, as well as monitoring decline if that's something that we see continually happening, or if there is any sign of decline. We have,
Sorry, 1 second.
Okay, there we are. We have what levels of assistance will be needed. So is lifting getting a little more complicated and hard for either a caregiver or the care recipient? Is there a need for help preparing meals or cleaning? And what type of assistance would be beneficial in providing the best care? So we also want to look at weighing out our pros and cons. So after we've addressed the major needs, we want to look at the positives and the negatives and kind of gauge where we are. Just to see if that list of negatives are a little longer, it might be time to consider transitioning or looking at different levels or a higher level of care. Another thing that can be considered would be highlighting what is important to you. As a caregiver, you've done what you can and you've done your very best to provide excellent care. So important in incorporating those things that are highlights or things that are important to you as a caregiver should also be considered. So what makes you feel safe and also provides comfortable care for them. So assessing atmospheres that feel like home if you're moving them out of the home, what gives them that homey and welcoming feel, even though it's not exactly what they've known as home. What communication systems might be different if they move or transition into a different care, especially looking now at COVID. Is FaceTime or virtual Zooms and stuff an option? Will you be able to receive update calls, and what will visitation look like? And just incorporating the elements of quality time that you know were important to you as a caregiver and how that'll look like if things are different, and how to make yourself feel as comfortable along as well in this process and transition in level of cares. We also want to think about the wishes of a loved one. If they're able to be active in the decision, having an open conversation about this transition is important. This can definitely be uncomfortable or difficult, but making them feel a part of the transition is important in continuing that connection as things may be or look a little different. Allowing them to share any key factors that they feel are important to them or anything that they wish to see in their transition of care, if that's a possibility or something that they can communicate to you.
Yes. So I'm going to talk a bit about assessing residential care options in specific, trying to decide which assisted living or nursing home is best for your care recipient. I know that can be a daunting decision. So first thing here, what are the staff like at the facility? When touring a residential facility, you try to pay attention to the staff's demeanor. Do they greet or smile at you when you walk by? Do you see caring interactions between the staff and residents? And do staff team seem to get along and work together as a team? You could ask about staff longevity. If many staff members have been on the team for a long time, that's likely a good sign. But keep in mind that this is an industry with relatively high turnover in general. You could ask about what kind of qualifications or training the staff have to kind of see if they have the training that you're looking for. Look at what activities the care facility has to offer. Will your care recipient be engaged there? Are there plenty of opportunities for socialization? When touring a facility, you might be able to even observe or participate in some of the programs. And most facilities have a monthly calendar that you can look at to kind of see what they have going on throughout the month. Look for variety. There could be exercise classes, service projects, educational programs, music, field trips, just all types of activities. So just want to see that your care recipient will be engaged there, and make sure that they have levels, activities to match the ability level of your care recipient. So make sure that there's variety there too as well. You could ask how many days of the week the activity staff are present too, to kind of get an idea of how committed the facility is to providing these opportunities. Next thing here is what kind of food do they have? Again, you might be able to see some kind of calendar to see what food they have offered during the month at facilities, see if it's healthy, if they have different options that meet the dietary needs of your care recipient. And another thing to consider is environment, the physical environment. Does the community look nice and smell clean and nice? Is there good lighting, including natural light? Are there nice outdoor spaces? Being outside has many health benefits, so it can be very helpful if the facility has an inviting outdoor area. Look for things like gardens and paths, benches, things like that. And ultimately, just ask yourself, does the place feel like home? Is it somewhere that you would feel comfortable and safe with your care recipient living?
All right, so a few more things to consider when looking at the best care options are definitely finances. That's a huge part of making a transition from in the home to maybe a facility, or even inviting another party in that will cost. So thinking about if Medicare or Medicaid coverage is a part of that transition, as well as does the care recipient receive Social Security? So will that be something to help with finances as well? And what do the facilities in your area actually accept, and what will come with those costs? It'll also be important to look at what out-of-pocket cost might be applicable, just to ensure that you have time to assess finances or sort out current finances. Out-of-pocket cost that could be included could be medication or appointments and transportation. And there's emergencies, sometimes things just happen. So having the time to assess finances and prepare for the transition is also very important. We lastly, when looking at the best options of care, want to assess the accessibility or things that we can accommodate to this transition. So if you're choosing in-home care, we want to be able to accommodate ramps and rails or new furniture in either your home or the home that you're moving to, just to provide the proper support. Or if you're moving into a nursing homes, what will the commute look like, or daycare programs, what will it be like to communicate, and how will I manage time? Things are subject to change, but we just want to consider how these changes will look for us. We do have a small chart on the bottom that just kind of estimates finances just from independent living communities, senior apartment buildings, respite care, adult day services, and in-home care, but these prices can vary, but these are good synopsises of what those prices can look like.
All right, so you might be thinking now that this is all great, but how do I get my care recipient to accept a change in care? So people are often very resistant to changes in care because they don't want to give up their independence or even, admit that they need help, which is totally normal and understandable. People with dementia in specific often don't even know that they need help. The brain changes that come with dementia can prevent people from understanding how much assistance they really need. And there's actually a medical term for this that I just learned. It's anesthesia. Another reason people often resist changes in care is that they don't want to give up their privacy. Bringing in someone to their home or living in a facility might feel uncomfortable or even invasive to them. Their home is their space that they've lived in for however many years, and that's just a big change. They don't want strangers there. So try to keep all these factors in mind when you're introducing a change in care to your care recipient. So here are some kind of tips, I guess, for introducing in-home care to someone. So this might be, if your care recipient is not yet requiring a great deal of care, they're really just needing a companion when you're not around. A way to do this that might be less difficult for them is to hire someone that's familiar to them. So you could bring in a neighbor, a friend, or a relative to be a part-time companion to them. You could start with the person just coming a few hours a day and gradually increase it so that your care recipient might not notice kind of the change in role. You don't even need to tell your care recipient that the person is being paid if you don't feel that that's necessary. You could say something like, "Isn't it so nice when the neighbor's here when I'm not around?" And having someone familiar provide care for a while might make the transition easier later on when you need to start bringing in a skilled caregiver from an agency. Framing in-home care as having help for you rather than for your care recipient might be another way to present this change in care to them that might be less upsetting or overwhelming. You could say something like, someone's going to be stopping by today. They're going to be doing some things for me around the house, but if you want, to spend some time with them or hang out with them, that's okay too. Or of course, you can just be upfront and explain to your care recipient that you really need help caring for them because you love them and you want them to be well cared for and, you can't do it all on your own. Whatever approach you take would just depend on your individual care recipient. So one more thing that you might want to think about is to be there the first few times that you bring in in-home care, just to kind of help ease the transition for your care recipient and make them more comfortable. Okay, so now introducing residential care for your care recipient, some techniques for that. So, that might be a little bit more of a difficult conversation than talking about bringing in in-home care. Could be more difficult to accept because it's, of course, a much bigger change. So before you talk to your care recipient, it might help to plan out what you're going to say, just come into it ready. You could write it down or practice with a friend or family member and think about what kind of questions your care recipient might have, how they might react and how you might want to answer. Decide how direct you'll be in talking to them about the reason for the move. Are you going to tell them that it's because you're no longer able to care for them on your own? and make sure to speak to them in a way that they'll understand. If they have cognitive impairment, use simple language, speak slowly, repeat yourself if necessary. And you may need to revisit the conversation later as well, but try not to talk about it so much that they get overly anxious about this change. So pick a time to have the conversation when your care recipient is rested and comfortable. And when you talk to them, be sure to acknowledge and validate whatever emotions they express. Just make sure that they feel heard and that they understand that you know how hard this is for them. And if you think that the conversation might go better with someone else, you can enlist help. So bring in someone else to help you lead this conversation. That could be another relative, healthcare provider, or religious leader. So talk to them ahead of time to make sure that they understand why the move is happening and help prepare them for the conversation. You don't have to go into it alone. Yeah, so I'll turn it back over to Ariel for our closing.
All right, to close up, we just want to thank everyone for coming and taking the time out of your day to listen to our presentation. We hope that all of this information will be helpful and will be useful for you to take away with today. I want to just give a quick hand clap and pat on the back to all the caregivers that came today and were able to come and listen to this information. This is a very hard time for everyone, so thank you guys for taking the time to come and listen to what we have to share. We're rooting for you, especially during this time. We want to take a little moment just to share some aging transition resources that we have that are available within the Department on Aging. And we have options counseling, which is briefly what Natalie mentioned, and they can help you assess all of the things that we went over today, as well as lay out what are your potentially best options. We have our caregiver support groups and other support programs. The caregiver support group is every second and fourth Thursday and Friday of the month. That may change just due to some holidays. And we also have other support groups and group activities that are offered to the public, of course, virtually. Now, there are some virtual daily activities, and the Senior Times will be sending out a resource pamphlet with all this information on it after. But your Senior Times will have the website as well as the outlined upcoming dates and event calendar in that. And the activities range from exercise, yoga, cooking, technology, all the way up to arts and crafts. So anything you can think of, there probably is a virtual activity for it that is offered through Aging Transitions or the Department on Aging. We have our clinical services, which is offered by our lovely licensed clinical social workers. We have our aging helpline, which provides resources and assistance to callers Monday through Friday, 9 to 4. If we're unable to answer during that time, we'll definitely be able to get back to you if you leave a message or send a quick email. We have Volunteer Connect 55, which is a great way to get engaged in the community if volunteering is something that you are interested in, as well as they have programs that can be utilized like food boxes, as well as their Handy Helpers program that does repairs. Lastly, we have our respite program that after you're pre-screened, you may be approved for some respite assistance hours. So plenty options and resources that are offered directly through the Orange County Department on Aging. And again, we just want to thank everybody for coming out and listening, and hopefully the information that we shared was helpful and you all enjoyed everything. And if there's any questions, we'll now open the floor to everyone, or if there's any that were in the chat box, we can address those as well.
Thank you so much, Ariel and Natalie. This was very helpful. I know I learned some new things, and I'm sure everyone else did too. So I'm going to go ahead and stop the recording so we can shift over to some questions.